There are new unique medical methods that allow remote diagnostics of diseases and their pathogens, as well as effective treatment. We are talking even about complex and problematic diseases. Now we are talking about radiofrequency diagnostics and audio resonance therapy. So first, I will tell you about diagnostics. Every living organism, organs, organ cells, pathogens such as ticks, worms, microbes, fungi and mold, mycobacteria, viruses, prions, etc. They all emit frequencies, each with its own frequency spectrum. These frequencies are emitted mainly in the medium wave range, or in other words, in the high ultrasound range. Research into these frequencies began about 100 years ago by the outstanding American scientist and researcher Royal Raymond Rife. In addition to a number of frequencies of pathogens, Dr. Rife discovered 4 cancer pathogens, BX and biviruses, cancer fungus and monococcoid. Now we know more of them. Dr. Rife confirmed his discoveries by successfully treating cancer with his devices, Rife machines. Later, his followers rechecked his teaching many times and discovered the frequencies of new pathogens. A particularly significant contribution to this area was made by the American naturopathic physician Huldah Clark. Clark's frequencies are also widely used for treatment. Basically, treatment methods using resonant frequencies began to be called bioresonance therapy. Let's return to diagnostics again. The author of radiofrequency diagnostics is the Ukrainian alternative medicine and general practitioner Igor Ivanishchenko, Ahor Protonhol. This diagnostics has been successfully tested on dozens of patients. Its peculiarity is that it can be carried out at a distance, thousands of kilometers from the patient. Which is why its former name is web diagnostics. A radio station is used to scan frequencies. The doctor must see the patient via video link and conduct a short consultation to narrow the search. Otherwise you will have to decipher thousands of indicators. Unfortunately, diagnostics are carried out manually and then it is pure mathematics. In addition, a fresh photograph of the patient will be needed, which will be scanned by the device. Photo scanning takes about 40 minutes. And decoding takes a full 3 to 4 days, plus 1 to 2 days to create individual audio resonance therapy programs, with the patient's consent to treatment. For several years, the doctor has been publishing the results of the diagnostics on the internet in Russian and Esperanto, naturally, with the consent of his patients and without disclosing their personal data. You can see how radiofrequency diagnostics becomes more and more informative each time, because new frequencies are constantly being added to the database, which must be calculated for the radio range, and also calculated again, differently, for the therapeutic sound range of audio resonance therapy. In the results, we will see 16, sometimes 17, tables that reflect all the patient's indications, that is, his diseases and their pathogens. They are arranged according to the rating, average disease activity and pathogen aggressiveness, and peak activity, activity during a surge, crisis, attack. The levels of the disease, rating, and activity are highlighted in different colors. On the side or below you will see a list of gray readings, without rating and activity. These are insignificant readings that can be ignored, that is, the patient practically does not have this. The tables start with general readings, such as different types of pain, intoxication, immunity, etc., then viruses, including coronavirus in great detail. Then come bacteria, fungi, protozoa and nanobacteria, which play a role in the calcification of blood vessels in atherosclerosis. The formation of kidney stones and salt deposits in the spine. Then worms, skin problems, diseases of internal organs, the endocrine system, the urinary tract, gynecological, nervous system and musculoskeletal system, as well as diseases that are within the competence of narrow specialists are examined. After that, problem organs are indicated, with disease activity in descending order. Next, a table will be presented with the patient's mental symptoms or diseases, his disorders and blood slagging or even blood diseases. In addition, the results of the study of excess of certain chemical elements are entered here. It is possible to determine the excess of any element of the periodic table. They can play a role in acute or chronic poisoning of the body with chemicals, and possibly also in case of suspected radiation exposure. The diagnostic results are completed by 3 tables on oncology, tables 14 to 16. In Table 14, the frequencies of cancer in general, viruses and fungi of cancer according to Rife, other oncoviruses, as well as tumor growth, neoplasia. In addition, frequencies of a wide spectrum are added here, each of which has many indications. Table 15 Oncological problems of the skin, head and upper body. Table 16 Oncomuscles, bones, abdomen and lower body. Under the tables of deciphered results, you will see several explanatory tables, including a list of combined indications for this diagnostics, when there are several indications for the same frequency. However, the patient should not interpret the results arbitrarily, because among them there will be confirmed results, complaints, second frequency, other studies of the patient, and unconfirmed. We call the latter threats. Most often this applies to oncological issues. After sending the diagnostic results to the patient, the doctor usually holds an explanatory webinar for him, where everything is explained in great detail. Now a little about audio resonance therapy, ART. Its frequencies are created from well-tested frequencies of bioresonance therapy specified in the treatment protocols. The peculiarity of ART frequencies is that they act simultaneously in 2 directions. They create a series of ascending harmonics of ultrasonic signals that affect the frequencies of pathogens, and also immerse the brain in a state of mental relaxation, trance and meditation. The trance state of the brain is necessary to significantly enhance the therapeutic effect. Therefore, it is recommended to listen to ART programs with headphones and in a relaxed physical and mental state, preferably with closed eyes. The usual duration of an ART program is 20 minutes. If the patient has chronic diseases, 3 to 5 ART programs are usually needed during the course. The period usually lasts 1 to 3 months and should lead to recovery or improvement of health. If desired or necessary, instead of or in addition to individual ART programs, an ART program can be created according to the bioresonance therapy protocol for a given disease.